most welcome to the last session of the Digital Health Hub series of discussions. And this afternoon, we shall discuss investing in digital health, business models, and public-private partnerships. Yesterday and earlier today, the discussions on digital health centered around the state of digital health in Africa, government leadership in digital health, and this morning we saw some examples of innovative digital solutions being applied in Africa to strengthen health system and service delivery. And the last session focused on digital health to screen and manage non-communicable diseases, which is a rising challenge in Africa. It is my honor to moderate this panel on investing in digital health, business models, and public-private partnerships. My name is Dr. Juliet Bataringaya. I'm the Health System Strengthening Advisor with the World Health Organization in Rwanda. I have worked in the areas of system strengthening for the past 18 years, supporting countries in the African region, mainly in the development of policies and strategic plans and strengthening health services management. My previous work includes the development of public-private partnerships in health policies and strategic plans, as well as e-health policies and strategic plans. Ladies and gentlemen, you know that development of policies and strategic plans is only but one step towards attainment of country health development goals. Implementation is critical and often the hardest step. It requires having a clear investment case and sound financing strategy and roadmap. So in order to take digital health to scale, sustained investments are needed. According to the WHO Global Survey on e-health, the spread of financial investment for e-health in Africa varies from country to country. In some instances, we have public financing, around 59%, that goes mainly in the setting up the foundation of the e-health programs. But when it comes to investing in the technology, we have over 72% supported by donors. And then we have public-private partnerships coming in at around 41%, and the private commercial forming a small part of that. So this session will explore how to take investing in digital health forward, looking at what models have been working, examples of public-private partnerships that have taken digital health to countries in Africa. Please join me in welcoming our panelists, who are key conversation leaders on digital health investments, the business models, and public-private partnerships. To my left is Mr. Norman Sheppel, Senior Expert, Digital Development and Project Manager, ICT with GIZ. Please join me in welcoming them. Thank you. Next is Mr. Haitham El-Nush, Senior Advisor, Innovation in Health and Development with NORAD. Next is Mr. Maryk Schiffer, Global Health Bureau, Strategy Analysis, Evaluation and Outreach with USAID. The only lady on the panel, you are most welcome. Ms. Teresa Pattery, Disease Management Program Leader, Johnson & Johnson Public Health, Global Public Health. Mr. Dicky Settle, Program Leader, Digital Health Solutions, PATH. And last but not least, Mr. Babakar Diba, Managing Director for Africa, ETRON. You're welcome to interact with our panelists and know more about them. I couldn't provide more on the bios because we are short of time. So now we move forward to the matter of the discussion. We know that digital health solutions, they range from the affordable, low cost, such as the mobile phones that can be used by community health workers, and they send codes to a central server. But we also have a wide range of expensive solutions, such as the drones to deliver life-saving blood or diagnostic for screening for cancers. The pricing of many of these digital solutions is often driven by the market. And we know that if items are left to the market, then the beneficiaries may have a challenge to access. So my first question is, if left to the market dynamics, African countries will not afford digital health technologies. Under what conditions and how can government intervene? I'll ask Mr. Norman to take ahead.
Yes. Good afternoon, everybody. It's good that you're here. I think it's an interesting discussion. To relate to this question, I want to, I think, make 3 points. This comes out of a donor perspective. GIZ is the German Development Corporation, and we are implementing a number of health projects and more digital health projects. It's a particular focus of the new government as well, so we will see a lot more projects coming. And obviously, we're asking a question, what can we do as a donor, but more important, who do we engage with? And there's a particular focus to engage with the private sector when you think of solutions that actually can be scaled, when you think of solutions that can be sustainable. The first thing I want to relate to is about strategy. It's, we hear a lot about digital health, and we all agree that this is something we cannot avoid, but we should take up. But the challenge, though, is kind of to have the evidence based on where to invest and how to invest. And in a sense, the narrative is there, we all agree on, but focusing and having the points where what is the most important in the priority areas, going from vision to the reality is much harder. And what I see, we should push this discussion a little bit. We hear about interoperability as a problem, we hear about the engagement with the private sector, but in a sense it's really not answering the questions we should ask. So strategy, I guess, is something we should look into. The second issue I wanted to raise also in regards to this question is innovation. In particular, teaming up with the private sector, innovation is often seen as technological innovation. So you have a new technology that is transferred to a particular context to solve the problem we have. But very often innovation happens somewhere else in the systems we are talking about. I want to give you one quick example from Rwanda. The community health workers here use the cell phone, the SMS-based system, as we heard before. But to make them do that or to enable that, they actually have to, or they were asked to form a cooperative. This cooperative receives money from the Ministry of Health, and through that they are becoming pork farmers, or they buy a taxi where they generate income. Now, enabling ICT or digital health, and this would be exactly also what you need to discuss with the private sector, is sometimes not the technology itself, but letting community health workers become pork farmers, in a sense. And I think that's very important to know, that changes in the systems is that what we should think along that. And the third point I wanted to make is on market, and we talk about public health systems. The market for the private sector is a very hard one. So it's not that they come in and bring their technology, it's they have to find a business model. So in a sense, this is, I think, what we have to provide, thinking along, what is the business model behind it, and not bringing the money as a donor or the public health system. So these 3 points, I think, are very important.
Thank you. But with regards to pricing and the need for countries to access, what are the options that governments may have? And I'm going to ask Mr. Maryk to talk about more of that.
Yeah. Hello, everyone. Thank you for attending the session. So one of the big trends we've seen over the last decade of systems that have been deployed are ones that we commonly refer to as global goods. These are often open source platforms that multiple countries use and have improved over the last decade. Some of them are in 70 plus countries. And recently we asked internally inside USAID, what's the value of these platforms? How much are they worth? Because we built them often with a combination of private sector funding, with public funding over many years in little pieces at a time. And it turns out the value is incredibly high. The results of our studies show that the platforms could be worth up to $76 million in replacement value. So if you were to try to rebuild that open source free tool that's on the internet to be downloaded, it would take $76 million of investment. So if you're thinking of where are there business opportunities, and you're an African entrepreneur, there are these tremendously valuable assets just sitting there waiting for some company to build themselves around them. And I think that this provides governments a strong reason to choose platforms that are being used across a wide range of countries, and it provides a good reason for companies to provide support to those platforms and improve them.
I look at this question of access and technology and the prices of this from the point of view of what we have as challenge now, which is a digital divide, right? So we have the market that is now leading us to this divide, meaning that low and middle income countries are not experiencing the same benefit from technology development as rich countries. So in this situation, donors like ourselves, like the Norwegian Development Agency, NORAD, should step in and try to deal with that divide. One of the things that we have done, or we have been doing, is pushing the DHIS2, which is a district health information system. This application is now free, it's open source, free of charge. Now downloaded in use in 70 countries, over 70 countries. It came out of University of Oslo, so that's why it has a package of training for master and PhD students who go back to their countries and lead this work, and so on. So this is one of the examples of public goods that can help bridge the digital divide, focusing on health. So countries should benefit from that, but again, there is a role for governments using the system is to enable the environment around such systems. Because from our observation, DHIS2 functions better where the environment is enabled. So this is a direct task to the countries to benefit from such system. And again, later in the discussion, I will talk about cost perception here, but I will give the chance to my colleagues to give inputs.
So thank you.
Therese.
I think this morning's session, we heard that 90% of people all around in Africa have a feature phone, and it's only 10% who have a smartphone. And if we want to make it inclusive and we want to reach every patient, which is really not located close to a rural clinic, to a hospital, the only way we can do that is digital. And the only way we can do that is working together. So it involves public-private partnerships. It involves an equal input from the Ministry of Health to support it, and also to actually open up and work cross-border. So if we don't do that, we will be selective in the population that we're choosing, and the patients who really need it the most are going to be deprived. So digital technologies play an important role.
Thank you very much. Now, when we talk about governments accessing these digital health technologies, I'd like Mr. Dickey to comment on government's negotiation, how to leverage economic communities, please.
Sure, thank you very much, Juliet. Yes, thank you all for coming to the session. So one of my common refrains during this session that I'll be returning to is the power of digital health peer learning networks, particularly regional networks. There are a few that have begun to emerge as very strong support at the regional level for individual countries. Those include the WAHIT, the West Africa Health Information Technology Program of the ECOWAS, West African Community, at WAHO, and Digital Reach at the East African Community. And one thing that countries can do to really help get the prices lower is leverage their economic communities, whether that would be West Africa, ECOWAS, whether that would be East African countries and the EAC, the East African Community, whether that's the Southern African countries and the Southern African Development Community. There's opportunity for collective bargaining to begin to bring prices to a place where countries can more effectively afford where technologies are getting too expensive. Thankfully, we also see technology companies, particularly progressive ones like Tableau, I'm going to bring them up a couple of times as well during this session, have begun to try to model their pricing and adapt their pricing to the gross domestic product, to the GDP of the country. And so where we have progressive technology companies can meet the collective bargaining opportunities of countries and their economic communities, we're going to be able to see the gap of affordability begin to lower and the opportunities emerge for strong technologies supporting digital health platforms.
Thank you very much. So we understand that, yes, the technologies may be expensive, but there is value in countries coming together to negotiate, to leverage the economic communities, to lower the price, and have these technologies accessed. Now, digital health solutions are deployed, as you know, to address inefficiencies, effectiveness, to improve quality of care that is within the system. Resources are mobilized and are invested, and yet some of these digital health programs fail. So the question is, why do they fail? And I'll ask Mr. Hatham to take the first response.
Thanks. This morning was a talk about failure, and the main failure that was mentioned is about being tech-driven. So I will leave that. The other failure is there are so many pilots. And just to provoke for discussion here, I have no problems with having so many pilots. Because you have to test, you have to learn, you have to provide knowledge, you have to provide evidence. And this is what we have done or have been doing since 2010. We supported a catalytic grant mechanism that provided us with 26 projects that now in the pipeline. We have learned a lot, right? Peter Benjamin from Health Enable mentioned yesterday in South Africa, they made a survey from 125 mHealth projects, 70% are no existence now. Fine, but we got Mom Connect, which is the backbone of the first worldwide, nationwide mHealth program, right? So there is a benefit of trying. Then, having so many pilots by then were good, benefited us a lot. Now, as donors, we realize that, okay, we need to have sort of convergence, right? And moving to countries, donors agreed now or working on agreeing on a set of principles for investing in digital health. We have different rounds. We came with a set of 10 principles that will help us align our investment to countries' digital health strategies that are in support for digital health strategies in these countries, national health strategies. And this will help us, address not only the digital part of things, but the non-digital parts as well. So just I think we are very excited about this opportunity. We have been inviting agencies, foundations to join to endorse these principles. And we are going to move to some countries to test how this can work. And we invite our partners to be part of that if we come to Rwanda or in Kenya or wherever. So this is going to be our way of going forward, investing in digital health collectively.
Okay, thank you very much. I'll now invite Mr. Babakar to share with us his experience on successful applications of digital health solution within your environment. Thank you.
Thank you, Dr. Juliet. First of all, just would like to add on Ali's comment that part of the culture is as well is coming from the ownership. If any project, wherever you deploy it, there's no ownership coming from the community, it will fail anyways. Okay. We are a tech company, actually. We are working in the water and energy sector. And we are working with all the utilities in Africa most of the time to help them produce water of good quality and access to sanitation as well and electricity. What we are doing as a social responsibility in our company as well is that we are encouraging and financing the development of those digital solutions for health at a very low community level. And we've done some projects in Mali. We are doing some other projects in Burkina Faso and related to malaria or to maternity. And this is very interesting because seeing from our perspective where we are seated on a tech company operating in water and sanitation, people are not expecting us to be there, but it's a responsibility at some point. And the good point is that with those applications that has been developed, population today are capable to say exactly if the quality of water is okay of what they have received, because this is a basement. the sanitation as well, if everything works well. And there's a report which are sent to the Ministry of Health. So we are trying to scale this in most of the countries where we are doing projects. And yeah, that's what we're doing today.
Thank you very much. I'd like to invite Mr. Dickey to give us an example of public-private partnership models that have worked in Africa.
Thank you again, Dr. Juliet. So my favorite public-private partnership is one that PATH has been supporting with support of the Bill and Melinda Gates Foundation for the MASEPA program in Zambia, particularly the southern region of Zambia. And what the MASEPA program has put together is a fascinating interoperable mix of technologies. They include some that you've already heard about, the ODK, Open Data Kit for data collection, DHIS2 for transmitting information. But then the public-private partnership comes in where the MASEPA program has partnered with Tableau, Alteryx, Exasol, Digital Globe. It's actually quite an interesting combination of mid-range but very high-tech data analytics and data transformation program. And it's been a really interesting public-private partnership because it's not just about the donation and contribution of the technology. It's also been about engaging the expert users. Tableau calls their expert users their Zen masters. And they've engaged their Zen masters in the efforts to address malaria elimination and to collect data on the malaria cases and to provide very targeted interventions to address that malaria. And the Zen masters have helped the stakeholders, the teams on the ground who are addressing the malaria, really analyze their data and to develop new interventions and new approaches. And together, this collection of companies and PATH and the government of Zambia have managed to reduce the incidence of malaria in the southern region of Zambia from 8% to 0.6%. And the government has said they really see malaria elimination is now really a reality. And this is a very portable approach, right? This is something that can be leveraged with some of these regional networks and shared with other countries. And by leveraging some of these global good technologies can help facilitate a direct, targeted, information-driven approach to malaria elimination.
Thank you very much, Mr. Rez. Could you add on that, plus what you'd consider the foundations for successful investment in digital health?
Yeah. So just to add on what has been stated, from Johnson & Johnson perspective, we've been working with Uganda, with the Infectious Disease Institute in Kampala, on the infectious disease side for HIV as well as for TB. And the Ugandan Academy rolled out a digital health platform to support HIV patients. And it's not just in big hospitals like Mulago, but also in rural clinics. And what we've observed is that you just cannot bring a digital technology in there and expect a paper-based electronic medical record to be the source document, because that puts a burden on the healthcare personnel as well to maintain and have both of them. So it's important to try and understand how those clinics and how those hospitals can actually work with digital technologies, have digitalized or electronic EMRs, which can replace it so that patients can benefit and healthcare workers can actually be freed up from their time and spend more time on patients as well. Now, that being said, it's also important to make sure that they are monitored right and that patients are taken care of very well. And it's both literate as well as illiterate patients that we have to target with digital technologies. Some of them cannot read SMSs, and so we need to have voice response. So we have a voice response system which targets its patients in rural centers who are not able to read and write, but who sort of get a message to take their medications for HIV on time, and they can respond, I've taken it, or I've forgotten, I'm going to take it, or I have not taken it. And they can also do symptom reporting, which means they can say, I have a fever. So in other words, you're actually collecting safety information as well on the background. So there's plenty of ways you can actually promote adherence, you can actually monitor how patients are doing, and the burden on the clinic, because every patient doesn't have to come to the clinic. If you have patients who are pretty adherent, they can actually be monitored from a distance, whereas all the ones which need to be taken care of, counseled, and have to make sure that they don't fail their first line and move into second line, which causes a burden on the economy and the country, you can monitor them with a differentiated care model approach. So digital technologies really play a difference, and we have seen that in Uganda. In Rwanda, we have started up with the Ministry of Health and with partners in health to work on mental health using a track and trace tool, which has just finished the contracting. So the intention is the same, to try and empower patients, to educate and raise awareness for patients and healthcare personnel, to try and use these technologies to the maximum possible way so that it benefits the community as well.
Thank you very much. Ladies and gentlemen, in keeping with the theme for Transform Africa, Smart Africa, we want to understand whether there is space for regional innovation networks and hubs to foster development on digital health solutions in Africa. We are looking for solutions within countries, but also across countries. So I would like Mr. Norman to comment on that, whether there is a future in that, what is already happening, and what can we do to move forward on that.
Yeah, thank you. Maybe also connecting to the previous question a little bit. We have failed big time engaging with the private sector, and our public-private partnerships we had were actually not, and I shouldn't say this actually, but we're not as successful as we would like to have it. But we still believe that's important, and one of the activities we are doing at the moment is we set up kind of frameworks where we discuss, collaborate, and engage with the private sector. There's a strategic partnership, Digital Africa, which works a bit as a hub, so there's a stock-taking process of what's already happening, but then also kind of in these kind of innovation processes like hackathons or ideathons or things like this, we at least want to see what is out there. There's certainly a task for the tech community out there to engage, but we also recognize this is extremely difficult. If you ask a young tech entrepreneur, what is your idea about public health? He comes up with great ideas, really great ideas. But it's very hard to take them up, and it's very hard to scale them, and it's also very hard to, bring them to the user. So in a sense, we believe that there's a strong need to collaborate. So we do need hubs that bring together the discussions, that invites the private sector to also kind of look deeper into what it actually means to design a solution for a public health sector. But it is challenging. So in a sense, we are working on that, but it will also not solve all that what we're looking for.
Mr. Maryk, you have a comment about building regional networks?
Yeah, so one of the real strengths in Africa, I think, is these regional networks that have emerged. And a lot of them have turned their eye towards digital in the last few years. We have the Digital Reach project. Professor Gibson Kabiki is sitting here, and he's been leading this effort, getting the governments of all 6 countries of the EAC together around a common digital strategy where you can get some of those leverage points, that sort of comparative, that ability to purchase at a regional level as opposed to at a country level, where you get alignments of curriculums and you get alignments of strategies and interventions. You can start getting more cost efficiencies that way as well. We've seen similar efforts in ECOWAS. We've seen similar efforts in Southern Africa. And I think that the AU has a particularly large role to play when we think about the need for cross-border data sharing, or how do we effectively share data. And a lot of that comes down to the need for, technologically, we can do it right now as it stands. Like, we have the means to do it. The standards are emerging, but the policy and regulatory frameworks don't work. A lot of the countries' privacy plans are from the 80s or 90s. They haven't been updated to reflect the needs of the digital age. And a lot of the approaches, the mindset, to go back to the original plenary speech, of a lot of countries is to hold their data closely and to be afraid of someone seeing their data. And that mindset needs to shift to say that data should be available to those who need it when they need it. And that's how we're going to see improved health outcomes. And I feel like the regional networks have really taken a strong stance in helping change that mindset and move those pieces along.
Thank you very much. My last question to the panel is, when is an investment necessary? I mean, critical. Because some of these new technologies may be quite expensive. And how do you weigh the return on investment and the economics that come into play? So I'll request any panel member who would have much to share regarding when would you consider investing in a digital health technology? Yes, Mr. Dickey.
Wow, I think almost the question needs to be, when should you not invest in a digital technology? I mean, digital is so powerful, right? I mean, there is no aspect of healthcare that is not accelerated and amplified by digital. We have some audacious and very important goals for healthcare, right? We have this vision of universal health coverage, yet we have enormous health worker gaps. We have enormous fragile systems and unresilient health systems that are trying to meet these needs. We have an inability to really pull the costs together and help invest in the health coverage and to achieve these health goals. It's my very firm belief that without digital technologies, we're not going to be able to achieve these goals. We're not going to be able to achieve universal health coverage. It's critical that we find rational, architected, thoughtful ways to bring technology, not the wasteful, duplicative, fragmented approaches of the past, but intentional, country-driven, country-owned programs and approaches into a national digital health platforms that can really help achieve and meet these needs. And the opportunities are just enormous. There's really no health system constraint, not access, not availability, not health workers, not commodities and supplies, not health financing, that cannot be improved with digital.
Thank you very much, Mr. Hatham.
I like the question. You said when to consider. You didn't say if. So you are implying that people should invest. And I like that because this is the way to go. I mean, you look to rich economists, people are saying, okay, digital health is going to transform everything. It is the same for low middle income countries, but we need to help in that regard, right? So I see partnership here because the task is so huge, right? You think of infrastructure capacity, regulatory framework, and so on. So the task is huge. So I think there is a role for development agencies. That's why we have this coordination principles. We would like to put our acts together. This is one step. I see a role for private sector. I mean the examples that my friends here presented, and I can also present some if you want. I see a role for the regional development banks, right? Because they support countries and they support their budget. So that is a role which is very important because we are good at different things, right? I cannot support infrastructure, but the African Development Bank can do so, right? So come to our projects, right? Come to our collective action. Invest in the things that you can invest in, and we can do the same. So the package will be hugely beneficial for a country. So this is one way of doing things. And again, investment is a financial term, right? So what's the return? The return is, better health, strengthen health systems. And by the way, I read this morning there is an outbreak of Ebola in DRC, right? And then this brings us back to the strengthening health system thing again. So investment is financial term. What is the return? The return is better health. And it's not only that. So one of the arguments for pushing digital health is the cost-saving potential of it, right? So the question is not about how much it will cost you, maybe how much it will save you, right? So you have to put that in calculations. And if you look at big economies, the US uses 18% of its budget in healthcare. Oh no, 18% of GDP, sorry. In Norway, 10% of the GDP, that is up to 350 billion Norwegian kroner, right? And people are saying, okay, if you bring intelligence to the health system, when you make diagnosis more accurate, treatment are right, and so on, there is a lot of saving potential in bringing efficiencies to the health system. So this way, it is more of a saving potential, not cost.
Yeah. Just want to add on that, as an infectious disease specialist, if I look at HIV today, a first-line treatment is one pill a day. It's called TLD. It's got 3 medications in one, and it costs the government $75 per patient per year. So we've reached that stage today. And we want to try and keep as many patients on first-line treatment as long as possible, because by the time they fail and they move into second and third line, it costs the government and it costs the patient a lot as well to take as medications with all the side effects. For TB, it's a curable disease. So if they've been diagnosed with TB and they can be given treatment and within 6 months they can be cured, that is much better than when you've lost patients to follow up and then they develop drug-resistant tuberculosis as well. So there is a win on how we manage patients by using digital platforms. You save a lot, the government saves a lot as well.
Okay, Mr. Maryk?
And I think that the question really shouldn't be when, it should be how. So why did digital health investments cost so much? Well, we're building 15 of the same SMS delivery programs in the same country, all with a different name on it. All of them do one thing. They send a message from a health facility to a patient. We're building 15 different analytics platforms. We're purchasing licenses for them in the same country, each one for different silos. We're doing the same thing for supply chains. It's not that we're not spending enough money in it. It's that we're spending that money particularly poorly. And I will speak on behalf of USAID. We could do a much better job ourselves of coordinating our own work. And so the answer to, in my mind, of this question is we need to start spending the money we are spending in a lot more intelligent way. We need to think about the digital health platforms of the countries, and the WHO and ITU have been here this week talking a lot about the new platform-driven approaches they're pushing out. They've also put out a taxonomy of all of the different ways that digital health interventions have improved health systems bottlenecks. And there's over 54 different abstract categories that WHO has published that each one of those can be linked back to different systems and approaches. And so we're starting to reach the point where you could say we should be investing in national platforms that fulfill many different functionalities. And that the governments themselves should say, what are the health problems we're having, and what are the known evidence-based interventions that are digital that can address those health problems, and we can deploy them cost-effectively and efficiently. And I don't think this is science fiction. This is like we're at the cusp of this. We're starting to see this emerge in a number of countries, Rwanda being one of them, South Africa being another on the continent. So I think deploying a digital health platform gets you cost efficiencies, and it allows you to try many different things that are evidence-based as opposed to random pilots with random applications and random approaches.
Thank you very much. I'd like to invite contributions from the audience, please.
Thank you. My name is Magnus Conte, and I'm the Executive Director for the Community Health Academy with Last Mile Health. I just want to say what an excellent panel. Whoever thought of putting these guys together actually did an excellent job. The issue of investing in digital health and taking this to the next level is currently being discussed quite a lot from the point of view of investment in the platforms, in the technology. But I hear very little being said about investing in creating the enabling environment from a regulatory and governance perspective that will create the environment that will encourage private sector investment, that will encourage USAID to invest or other foundations to invest, to make sure that those investments are being embedded within the right regulatory framework that would ensure that we don't have all this duplication of efforts, all these pilots that are for short periods of time and they are abandoned because they cannot be taken to scale, or because the environment is so restrictive. Because again, we shouldn't over-regulate. It could be light touch regulation, but at least create such environment. Like, for example, recommendations coming from the Broadband Commission published last year about the leadership and collaboration between the Ministries of Health and the Ministry of Information and Communication. Investment in the realization of those type of recommendations is the sort of thing I'm referring to from a governance and collaboration perspective. But from the regulatory perspective, I think there needs to be some investment made into that. I would just like to hear the thoughts of the panel about that.
Okay, can we have other questions, please?
Yeah, thank you. Mine will be more the bringing up some issues in relation to this. So we talk now, we're talking more about...
Introduce yourself.
I'm Gibson Kibiki. I'm the Executive Secretary of the East Africa Health Research Commission, of which Maryk just mentioned. We have the initiative called Digital Reach Initiative for the 6 East African countries. So we talk of making this an investment case and bring in the private sector. But I think at the same time, since this all is new and even to technocrats, leave alone the bureaucrats, I think we also need to synthesize the language in a way that it will be understood, and then it can help us to move forward. We give more often the example of Canada, how successful it has been, how much it has saved after investing. But Canada is not Africa. The environment is completely different. So we can't really just take as it is and say you can apply the same in East Africa. And there haven't been a true digital health model that has matured enough to say, look at this example. Or what we're talking, they have just started. So they haven't gone far, and it takes time. So we need really to come up with that. Also, we haven't made this really a very clear investment case. We haven't defined this as an asset rather than a liability. Most of the time, health is regarded as a consumer of resource than a producer of a resource. So how do we make our case that it looks more as an asset rather than a liability? So I think we have to tune our language carefully so that it makes case. The private sector, it shouldn't be more of asking, but also to say, what are you giving? Because it is a give and take, and that will help really to merge. Thank you.
Thank you. Additional question at the back, please.
Thank you very much. Florence Godry-Perkins with DHP, Digital Health Partnerships, passionate advocate of digital health. So I couldn't have said it better than what you just said, Maryk. And Magnus, you mentioned the regulatory framework, but if you look at a national digital health strategy, there are 7 pillars. And you also referred to leadership and governance, Magnus, which is kind of the basic pillar that if you don't get that, then it's very difficult to implement the 6 others, right? But there's also human resources, right? So ITU-WHO's latest strategy, which is fantastic and amazing because it's bringing us to think, again, more from a systems, perspective versus the solution. So yes, we have been fragmenting the system. The irony of this fragmentation is that digital, by definition, is what can finally break the silos and bring us to a patient-centric view, which we all want to get to, okay? So I think the priority of the investments, and you've said it on the panel today, is in fact creating that interoperability, that common platform that's going to bring everything together. Because as Maryk said it, we've been wasting money constructing parallel platforms, and I mean, it's just been, it's chaos out there. My question to you guys is, we're talking about building roads. So we've been building bicycles, cars, and a few buses for the ones that have really scaled in the real true multi-stakeholder partnerships. Roads are by definition, and it goes back to the Broadband Commission report from last year that Magnus just referred to, are more expensive. So I don't have full visibility out there, but we know that Rwanda's National Digital Health Strategy cost $35 million the first 5 years. Not that you get everything done in 5 years. Gabon's strategy is actually a World Bank investment, is $50 million. I think Tanzania, Mayor, correct me if I'm wrong, is about $70 million over 5 years. Now, when I talk to development banks, there's very different levels of maturity on their understanding of what this is. And when you talk about human resources, that is one of the 7 pillars of a full national, full-fledged digital health strategy. To give you an example of what that means, everybody talks about we need to train people to use, say community health worker mobile phones. It's not just that. To give you an example, and it's only one little one, is in Rwanda, they deployed a data manager and a monitoring and evaluation person in every health center in the country. We're talking about massive investments. How do we get everybody on the same page? Because I get the sense, you mentioned African Development Bank, there's not necessarily a digital health person in the health department of the African Development Bank. So I'm just throwing that question out to you. As an ecosystem, what could we do to get the ecosystem ready for the kinds of investments that we need today, meaning those roads, which are a very different ballgame than what we've been doing up until now? Thank you.
Thank you very much. I'll take 2 questions, and then I'll ask the panelists to respond. Here, and then Derek.
Thank you. Kalisa Emmanuel, country coordinator of Young African Leadership Network, looking for health awareness. My question is looking for the panelists. we are creating we are talking about health digital. But sometimes those we are creating, we are looking for the urban areas, but there is rural areas. How can we focusing on those rural areas? Like, for example, here in Rwanda we have like a bubble. When you are here, you consult like a doctor. You have like technical issues. You are not feeling well. Doctor come up to check up with you, and you tell about what you are feeling up. But those people who is in the rural areas, they don't have those facilitating. How can we focus on those people to come up with going on same level on urban rural areas? Thank you.
Thank you. Derek?
Thank you so much. Again, as somebody mentioned, very excellent panel. Very the topics that you've addressed are very practical. And what I would like to really bring to the table is an area of investment that usually goes without saying, but often goes without doing. And this relates to, I guess, what Dickie talked about very practically, attaining country ownership. And I think yesterday we talked about the fact that you can't own a system if you do not have mastery, cognitive knowledge about that particular system. And I think in reflecting to the growth of digital health, most of the investments we see were actually catalyzed by development partners. Okay, that's what we basically see. But at the same time, we have a critical issue of capacity within ministries of health. So more often than not, for example, we see a solution deployed by a development partner. When the program closes, the solution closes as well. Another program comes, they build a different system. So really the question that I would like you to reflect upon is, how do we ensure that we have a sustained investment from a technical human capacity level? And I'm really speaking about, for example, making sure that developers are within the government, and we ensure that the systems we're building are able to be maintained by developers. Now, again, as WHO, we've been thinking about this a little bit. We have a bit of good examples, like Cabo Verde, for example. They've been able to have an institution whereby they have, 30 developers working on intergovernment systems, including digital health. University of Nairobi is another. Okay, so these are the examples that we're really thinking to see if we can use what we call WHO collaborating centers, whereby we plug in the institutional knowledge or capacity to develop or write code in such a way that ministries of health can actually be capacitated. So what I'd like to maybe hear from you is your reflections on, in very practical terms, how do we make sure that if we have an EMR, a medical record system, the ability to maintain the software is invested and embedded within government, public institutions for purposes of what Dick rightly pointed out, country ownership. That way, once we attain that, we can indeed say this program can be handed over to the government and the government can take it over. It's not an easy thing, but I'd like to just hear your reflections on how that can be done.
Thank you. One last question.
Actually, I'm Hanna Skandera from ITU. Just in relation to Derek's comment, question, because that's one model is to give the software and all the digital assets to the government. But I think when we are talking about business and PPPs, I think the other alternative is to give that to the local private sector companies or SMEs and entrepreneurs, etc. And I want to link that with the issue of global goods. Because indeed we do have a lot of global goods that are available that, as Maryk mentioned, they probably valued for millions of dollars. But the problem that we have now that there aren't yet enough local providers who can appropriate those global goods and deliver those in the context of the country. So the question is how we bridge this gap between the global goods and the local capacity from the private sector community, not necessarily the government.
Thank you very much. The audience has actually challenged us in many areas around strengthening the foundations on which the digital health solutions are, framing investment cases so that then it is sellable in the right language, packaging the message, designing and communicating so that you can get the investors, scaling up to the rural areas and the community, how to interest the financiers once you've costed your roadmap and it is $35 million. How do you interest the financiers? How do you have sustained capacity? How do you involve local partners like SMEs and so on? So I think I'll start with Mr. Norman and we go from there. Thank you.
Okay, I'm trying to address some of the questions as I heard it. Maybe starting with the last one. It's exactly what we're seeing. This kind of new partnerships we need, and indeed, it's not just the governments. It's creating an implementation environment. We created a software with ECOWAS, for example, and then we had the software and we recognized nobody actually can, it's an open source software, but we don't have the local companies who would adapt to it. The ownership was there from the government, but then the World Bank came and they have this huge program and nobody could bid for the tender. Well, we hope they can now, but we recognize it's extremely important to have these local ownership and indeed in the private sector. I think one issue on that is also on kind of the traditional institutions working in health. They have to talk to suddenly other partners, and this is what is not happening yet indeed, and I think there needs to be a lot of work done on this side. But it's also kind of defining the path towards these partners. I think that's an important. And the last point, I was a bit kind of the bad cop here, tried to say it's really hard to engage with the private sector, but there is an important task of them, because the investments we will see should not come by donors, and this was asked a little bit, should donors give more money into that? But we have, for example, SIP want to invest in 500 million in Africa in the next 4 years or so. So some of the money that was asked for, we should ask SIP for, and they see obviously a market in that, and we need to create a business case around that. But if it's there and it's cheaper for the health systems to use these technologies they're bringing in, they certainly can also pay for it. So I think it's kind of making a business case out of these new technologies that is extremely important.
Thank you, Mr. Haytham.
To the issues of leadership, know-how, regulatory framework, and so on. So my response is, our meeting point is the national digital health strategy. And I'm saying that out of an experience that we had in Nigeria. So just a Minister of Health saying that, okay, we would like to do this strategy, or renew our strategy, or develop a new one. It's first shot for ownership and leadership here, right? So realizing that, okay, you need to have this strategy to proceed. So this is the first shot to have the leadership starting here. And again, in the process of developing this, you are going to know what you have from before and what the gaps are and so on. Because as long as countries develop into more interoperable systems, they need more technical assistance and funding, right? So the maturity level is very important from country to country. So it is what will work and will considered as advancing in one country is maybe outdated in another country. So the maturity level is important to look at, but the strategy will help you understanding that. And again, that will help also our peer learning networks to transfer knowledge from one country to other, right? So in convening these countries, they will learn from each other. And again, coming to the point, in the work to develop a strategy, you will face structural problems. Let me put it that way. Not saying political problems, right? But we will never find technical solutions to structural problems. And that's why the governance issue comes into play here. And the work on the strategy will help you address that, because when you see gaps that are not covered by expertise in Minister of Health, you will look at other departments and you will bring the ICT guys, right? And that is you put the first seed for a conducive governance model for your country. based on the process of developing the strategy, because you need different expertise in different departments because they don't sit in the same department. So that's why we are relying a lot now on developing these strategies together with Minister of Health and Minister of Communication in order to look at gaps and build on possibilities.
Thank you, Mr. Maryk. If you have the foundations already in place, how do you take forward the investment case, interesting financiers, building sustained capacity?
Yeah, so one of the themes that runs throughout many of the questions, whether it's regulation or workforce or investment case, is that they all represent different aspects of one big systems problem. And that system has been really well outlined by WHO back in 2012 in the eHealth Strategy Toolkit, and it identified 7 areas you need to co-invest in. And I think one of the tricks is that if you don't invest in all of those areas, systems don't work as well as you intend them to. And so another problem is that you can't rely upon a single donor, or even in many of the countries' context, a single government to invest in all of those areas simultaneously. It really does require collective effort. And I think that that's actually the new question, and the new thing we need to figure out how to pilot is how do we pilot working together as opposed to working apart. And so I wish I could address each of the questions. There were so many and they were so good, but I'm going to leave it with that and just give one last shout out to, I think, the launch of the African Alliance yesterday is a real step forward in providing the means for countries to work together and learn from each other and not make the same mistakes that have been made in the past, but get to make new ones.
Thank you, Mr. Reyes.
So probably I'll address Magnus's question on regulatory aspects and ownership as well. So it's important to mention that most of us coming from the European Union and from the US, we've battled through all this data privacy, data confidentiality, who has access to what data, how is data being de-identified and anonymized. And I think the learnings that we have, we should try and get Africa up to speed, to try and get them to embrace some of the things that we have actually learned along the rugged path, because we've reached there, we've got some regulations. And there's a steep curve, because when you speak to certain communities, certain countries in Africa, when they hear about cloud, they all get scared. What's the cloud? Where's my data being shared? What kind of information? So, I'm tagged right now, so people know my personal information. So there's a steep learning curve that we need to actually get through. And that works only when we work all together. There's no way that each country is going to do that. And I think Transform Africa Summit, having one African Union, means getting all the Ministry of Health to work together to embrace one regulatory forum. And we could potentially play a role by helping them, by telling them that whatever you store in the cloud is still under tight firewall, and it depends on who has access and what kind of access. Do you have access to information as well? Because knowledge is power. Whatever knowledge is out there can be shared to other African countries. So it's important to actually take that step out there. And that's important. But one of the other aspects that we're struggling with on the digital side is that all the ones which don't connect are going to be forgotten in some form or the other. So how could we actually get them also to be part of what others have? And the only way to do that mobilization is to have governments to embrace technologies and to promote it. And a company where I am sitting right now, it is a private company, yes, but we want to make sure that we want to make a difference for patients, for HIV, everywhere in sub-Saharan Africa. So we want to make sure that whatever platform, whosever platform that is, can actually help patients, we're willing to partner with them. All the clinical trials that we have done at J&J, the data is de-identified and it's accessible to everybody. We have a third party, which is called as a YODA project. It's the University of Yale in the US. So if anybody wants access to any of the clinical data from the Johnson & Johnson clinical trials, all you have to do is you have to make a request. It goes to this third party. They look at the request and they give you access to that clinical data, which has been approved by the FDA. So there should be some sort of a third party body as well within the African Union, where you can make a request to have access to data, and it's de-identified, it's anonymized, but benefits patients, it benefits communities and countries. And it also probably helps to prevent other epidemics from starting, because you might find hotspots of resistance or hotspots of things that are cropping up, and you can immediately take an action, like for Ebola, for instance, as an example. So how can we actually work to that space is also important to think about as we move along this.
Thank you very much. You've talked again about the cybersecurity, security of information in the cloud, and maybe a possible role for the AU in terms of helping countries to manage that. Mr. Dick?
With your permission, Dr. Juliet, my friend and colleague Ababakar and I would like to swap positions.
Yeah, Dick will have much more to say. Just a quick contribution that about the harmonization, which is a key. What we're trying to do still at the community level is to develop harmonized digital platform to alert on any water disease and malaria in the some West African countries. And it's a headache to have just the West African countries agrees from ministry to ministry, because whenever you're having malaria starting in the Gambia, for example, for sure you have it in Senegal, and sometimes it's a headache. So definitely it's key to have a better harmonization. And just one last point that I raised about, we were talking about is all these digital solutions have to be expensive? Myself, I think no. And if we could, in a certain way, through Transform Africa, motivate as well the AU, the African Union, to have a kind of, let's say, tax motivation, which could be taken from any transaction to motivate the scale-up of all these digital platforms.
Thank you very much. And I don't have much to say. We ended the inaugural panel of this track with the launch of the African Alliance of Digital Health Networks. I would like to end the final panel of this track by inviting friend and colleague Dr. Gibson Kibiki, professor, to come up and speak a little bit about digital reach, because I truly and deeply believe it is through these regional peer learning networks that countries can truly be supported to successfully own and deliver on their digital transformation of global health.
Do you want me to sit? There's another one there. I'm just lucky. He got me when. Anyway, thank you very much, the panel. It was interesting for me also, for the initiative that we have, to hear what the private sector would like to, because we are designing components, what the role of the governments, what the role of the development partners and the private sector. So it has been enriching to the work that we are doing. So just to brief you is that, and take you back, because there are issues about governance, leadership, etc., and being inclusive to such initiative, is that East African community has 6 East African countries: Kenya, Tanzania, Uganda, Rwanda, Burundi, South Sudan, and a few more which are on the process to join. It's a regional economic community with a parliamentary secretariat and a court of justice. So it's really operating like a single government. And people are freely to move across these countries, and the business also is free. Now, when all that is happening, also there's a healthy component, both benefits and risk. So in 2016, the ministers of health and finance, they met in Arusha, Tanzania, and they were discussing on how to achieve the sustainable development goals and also how to scale up the universal health coverage. And from there, they came up clearly that we have to embrace science and technology, and also to scale up utilization of digital ICT, and in order to improve healthcare delivery and also health outcomes. So it is from there that the East Africa Health Research Commission, of which I'm the CEO, we took this agenda and started consultations discussing on how we can move this agenda, which has been decided by our ministers, all from the 6 countries, both from finance and also from health. We developed a concept. We had a consultation, a wide consultation, international and local. And eventually, also last year in March, we had a East Africa Health and Scientific Conference. During that conference, again, it came out clearly that one of the recommendations is that we have to embrace digital health. So we concretized the concept, and we developed now what is called Digital Regional East African Community Health Initiative, or Digital Reach Initiative. we want to reach our people digitally, even those who are remote, so that they can also benefit as a way to, to improve the universal health coverage, and also to position East Africa in a position that we can attain to a good extent the Sustainable Development Goals. So what we have done, first we developed a roadmap that will guide us. Where do we really want to go? And to develop the roadmap, we had a meeting of all stakeholders from the region, outside East Africa, from West Africa, Southern Africa, and Northern Africa, from around the world, the Americas, Canada, US, and Europe, they all come. We brought in the private sector, NGOs, faith-based organization. You may know that in East Africa, about 60% of the healthcare services delivered by faith-based organization. So it was important really also to bring them in and to hear. In short, unanimously, all the countries, they said there's a role in this endeavor, a regional role as well as national role. So we defined what will be national, what will be regional, and also how the regional initiative will also support national programs and initiatives. And from that, the roadmap we presented again to the Council of Ministers of these 6 East African countries, and they endorsed, they approved, and directed that go ahead and develop the strategic plan and implement it. February this year, the summit of the heads of state, the president of these 6 countries, we presented again this initiative, and they endorsed and approved it, that now it is a priority for the coming 10 years. So I'm taking you through this. Want to know that technocrats were involved right from the beginning, and all stakeholders were involved, the private sector, government official, development partners, and all these together. And then also the decision makers who at times may not understand your language. We think digital health is a simple language. You trust me, not all know, or even at times when they agree, they mean it because they didn't get the point. So, but all in all, it has been approved, and what we are doing now is that we are developing the strategic plan, which we hope it will be complete by August this year, and the last quarter will be really mobilizing resource, and the beginning of next year, it will be the implementation. But what is important, what I say, the language, is that we have set several platforms that will allow us to continue talking with all involved, especially decision makers, to continue understanding what it entails when you talk. What are the economies of scale we talk about this? How much can we make sense that really this is an investment that will plow back, will bring back benefits, both in terms of efficiency and saving resources, and just how many people will be covered, etc. All this. We have formed a so-called EGOS Forum, East Africa Government Leaders, Legislators, and Legal Executives Forum. And this brings all the pillar, the 3 sides together, use a language that is clear to everyone, to continue explaining what it's all about and what it's going to do, how much is going to be a game changer, and what is the role of everyone. Now, within the strategic plan, as it has been said here, we have 9 work streams, mainly taking from the WHO ICT, ITU or toolkit, and also we have added a few, especially the health implementation in science. We want to do some programs that will be a proof of concept that this works and this is a game changer. But we want to do that also to test the enabling environment, if really is enabling this process before we scale it up. So these programs are going to start, some of them this year, and by so doing, we have taken advantage also to have a regional cloud. I know the chair said everyone gets scared when he hears about cloud. We faced the same dilemma when we mentioned cloud. Everyone was asking who is owning that cloud. So we have continued to explain, and we'll be generating data in real time. It will be analyzed. We hope that not on a regional level, but a national level, at a facility level, and we hope that in the future, even at the patient level, this data will be in a way accessible. The initiative which we want to do is to be citizen-oriented, patient-oriented, rather than data-oriented, which most of the time we have been driven towards gathering data rather than really saving the patient, treating patients in real time. And we want to focus to the community because everything starts from there. So if in the health facility they have a patient, we want to try to trace back to see what is happening in that community that this person had to come to the facility. I explained a bit about this morning to say the non-communicable diseases that are coming to Africa, they're going to present a different picture than the picture you see in the temperate world, the America and Europe, because they're facing chronic presence of infectious diseases and neglected tropical diseases. So the terrain is not the same, and we are going to face them in a different way. Thank you very much. If there will be questions, I'll be happy to answer. Sorry for just crashing. In the, what matters is being in the house. It doesn't matter how you got in the house.
Join me in thanking the discussant. I think you'll be able to meet with and have more questions regarding the REACH program. Unfortunately, we've run out of time, but the discussion will continue. We've heard that we need to strengthen the foundations on which these digital health solutions are built. And regarding access to the solutions, well, governments have an opportunity to collectively bargain for the solutions. They can leverage the economic blocks. They can benefit from solutions that have already been developed and be able to access and use them. Regarding investment, we have to invest together because there are many areas within the same project where different investors can come in and support. We heard that there are 7 areas around strengthening e-health within countries, and within each area you can have different partnerships. So the challenge is all of us coming together and working together rather than deploying solutions in different areas that will not talk to each other. We've had success stories of public-private partnerships that have leveraged the services and improved the health outcomes, including bringing down the prevalence of diseases and also engaging with the private sector and SMEs in terms of building sustained capacity. Ladies and gentlemen, thank you for a very interesting discussion, and join me in thanking my panelists for a great discussion.